My name is Jessica Lapinski. I am a third-year resident at Duke University. I was part of ELI last year as the class, and I have returned as one of the Best Project Award winners this year. So for my project, it was a smaller initiative, part of a bigger overarching clinic initiative that we are transforming our clinic to be an LGBTQ+ patient-centered medical home. For this specific project, we were able to do a fundraising and visibility campaign in order to increase not only knowledge of healthcare disparities within the LGBTQ community, but also raise funds for further research and programming for this community. For me, the most exciting part was actually when we first went into the community and they told us that they didn't want to work with us. They told us that you are not a group of people that we traditionally work with, and they pushed us away. And the reason that was exciting is because it gave us the opportunity to go back and show them that we actually care about you, that we want to make an impact, and that we're not going to go away. You could keep pushing us away, but we're going to keep coming back. So having that opportunity to learn why do marginalized members of our society react the way they do to medicine, and learning also how do you break down those barriers and take away the white coats, step out of the clinical context that we're all comfortable in, and actually go into the community and actually say, I'm a community member as well. I want to fight for not only your rights, but your health. How could we do that together? And that was one of the most exciting and just amazing aspects of this particular project. I kind of go back to the same thing, relationships. For me, I feel like building relationships and authentic relationships with not only community members, key stakeholders, other physicians, nurses, that is the part that as a family medicine resident doctor really makes me wake up every morning and excites me. So it's the relationship building and making sure that's a meaningful relationship. Oh, for sure. I feel like this program allows you to work with like-minded individuals that are not only wanting to change the healthcare system, but improve the care of their patients. I totally recommend it. I kind of talked about this previously, but the three things I'm going to say is, number one, engage your community stakeholders. It takes a village for any project to be successful. You need to work with other people and trust them to work to their fullest ability in order for you to be successful with your project. Plan ahead, but also be willing to be flexible and realize that every single door that closes, somewhere around the corner, there's a window that you could jump through, and that window may lead you down an even better and more exciting route. I think that in medicine, we're always told, especially as medical students, that we should only be clinicians. We should only be focusing on having clinical skills. This program actually teaches us that there's more to us than just being doctors. The doctors are actually MDs or DOs plus. We are actually advocates for our patients. We're supposed to be there to work with our patients and help ensure that our communities are healthy. And in order to do that, we have to be willing to look outside just the kind of preconceived notion of what it is that medicine is, to allow us to break down those barriers and say that it's okay as a resident, as a medical student, to do more than just clinical medicine. Because if you want to continue those skill sets into your future career development, you have to start them now. You have to start learning how to juggle clinical responsibilities with other leadership opportunities. And this is one of the few programs that not only allows you to do that, but they encourage you to do that, and they tell you that you are not a complete weirdo for wanting to do that.